Student, this lecture about management of patient with hepatic dysfunction and viral hepatic disorder. Also, you can review medical surgical book chapter 49. I will start with the definition of the hepatic dysfunction. Basically, hepatic dysfunction results from the damage to the liver parenchymal cell directly from primary liver disease or indirectly from either obstruction of the bile flow or the arrangement of the hepatic circulation. So you have to understand that liver cells are damaged by primary liver disease such as virus that attack the liver itself, or indirectly by obstruction of the bile flow, so such as, for example, gallstone, and I will explain this later. Cause of the hepatic dysfunction, a disease process that lead to the hepatocellular dysfunction, maybe because of the infection agents such as bacteria and or virus, as I said, anoxia, hypoxia, or medication and certain type of medication and nutritional deficiency. The most you have to know that the most common cause of the parenchymal damage is malnutrition, especially that relate to the alcoholism. So it's very important to know that patient with the with the alcoholism is more likely to develop hepatic dysfunction. Manifestation of patient with hepatic dysfunction, there is a different type of manifestation, and it's very important to know this manifestation. Patient with hepatic dysfunction or liver disease will develop normally jaundice, and also patient may develop portal hypertension, ascites, and varices, and I will explain more in detail about this later. And also patient in the late stage may develop habitoencephalopathy. So habitoencephalopathy or coma, this is a central nervous system dysfunction resulting from liver disease, and it is frequently associated with elevated ammonia level that produce a change in the mental status or alter level of consciousness. So it's very important to assess level of consciousness or mental status of patient with hepatic dysfunction, because maybe patient reach to the stage of the encephalopathy, and if the patient reach to this stage, normally the patient will have mental status changes in the mental status. And also it's very important because of that, if the patient reach to this level, we should reduce the food that high in ammonia, especially food that high in protein, and we keep patient in food that high in carbohydrate. And also other manifestation is nutritional deficiency, as you know that liver play an important role in the nutritional balance, and it's with the hepatic dysfunction patient will develop nutritional deficiency. Now I will explain all of these manifestations in detail. For example, jaundice, it's as you know that jaundice is yellowish of the sclera and skin causes by the increased serum bilirubin level. We have different types of jaundice such as hemolytic, hepatocellular, obstructive jaundice. And for example, hepatocellular and obstructive jaundice are most associated with the liver disease and most related to the liver disease. Jaundice become clinically evident when the serum bilirubin level exceed 2.5 milligram. I will explain now each type in more detail. Hemolytic jaundice, I already explained this before. It is a result from an increased distraction of the red blood cells, and there is rapid distraction of the red blood cells, so that liver, although function normally, cannot excrete the bilirubin as quickly as it is formed. And this is normally there is different different causes that lead to the distraction of the red blood cells. One of these causes is maybe because of the hemolytic transfusion reaction or other type, and because of that there will be distraction of the red blood cells, and liver can unable to excrete this increased amount of the bilirubin. Also, another type, which is hepatocellular dysfunction, is caused by damage of the liver itself. It is caused by the inability of the damaged liver cell to the clear normal amount of the bilirubin from the blood cells, and there is cellular damage because of the hepatitis virus or other other type of virus that affect the liver, and sometimes the liver are damaged, the cell of the liver are damaged because of the medication or chemical toxin or alcohol. So this is some of the causes that lead to lead to damage the liver. And also we have other type, other type of the jaundice. It is obstructive jaundice. Obstructive jaundice, it's from its name, it is mean obstruction obstruction of the bile duct. So if the resulting from the extrahepatic obstruction may be caused by occlusion of the bile duct from the gallstone or an inflammatory process or from enlarged organ. So there is an obstructive jaundice, there is obstruction of the bile duct. And for example, you can see here, this one, for example, this is gallstone, and this gallstone lead to the obstruction of the bile duct. And because of the obstruction of the bile duct, the liver unable to to do its normal function. Also, regardless of whether the obstruction is intrahepatic or extrahepatic, and regardless if it is caused the bile, as I said, the bile cannot flow normally into the intestine and become packed into the liver substance, and it is then reabsorbed into the blood and carry out through the entire body, staining the skin, mucous membrane, and sclera. So another manifestation of the hepatic dysfunction, it is portal hypertension. It is very important to understand that patient with the hepatic dysfunction may develop portal hypertension. In portal hypertension, there is an increased pressure throughout the portal venous system that results from obstruction of the blood flow through damaged liver. So what we mean by that? For example, this is portal vein, and there will be an increase in the pressure throughout the portal venous system, and this because of what? Because of the obstruction of the blood flow through the damaged liver. There is obstruction of the blood flow, and that lead to the increased portal venous system. And normally patient with the portal hypertension will have some of the signs and symptoms such as splenomegaly, a common manifestation of the portal hypertension, and other major consequences of the portal hypertension. Because of the portal hypertension, patient may develop ascites. Why patient develop ascites? Because this is lead, I will explain this more in detail, because this portal hypertension lead to accumulation of the fluid, and also portal hypertension lead to the varices. So varices, that there will be, for example, there will be enlarged veins near to the esophagus or the stomach, and this is also, I will explain more about this in detail in the next slide. So ascites, for example, you have to understand that because of the damaged liver, or such as cirrhosis, that lead to the liver, we will end by portal hypertension, because as I explained, liver dysfunction may lead to the portal hypertension, and portal hypertension will lead to the ascites. Also, you have to understand that as I explained, that ascites is one of the signs and symptoms developed because of the liver dysfunction. Also, in the patient with the liver dysfunction will have reduced an albumin level. When there is a reduction of the albumin level, this will lead to the decrease in oncotic pressure, and this will lead to the accumulation of the fluid in the abdomen and ending by the ascites. So it's very important to understand that low oncotic pressure caused by the low albumin is the major causes of the development of the ascites. And this is other type also pathophysiology, but this is one of the major pathophysiology related to the liver. You have to understand that portal hypertension, that reduced albumin, all of them lead to the ascites. Assessment of the patient with the ascites, it is an increased abdominal girth and a rapid weight gain are more common, presenting symptoms of the ascites. So it's very important for you as a nurses to to check the abdominal girth and to check the weight of the patient who develop ascites, to understand the assessment of this patient. The patient may be develop also short of a breath, and the patient may will have distended vein may be visible over the abdominal wall. And also the patient, when the fluid has accumulated in the peritoneal cavity, because most of the fluid accumulate in the peritoneal cavity, the flank bulk when the patient assumes supine position. And also the patient with ascites normally will develop fluid and electrolyte imbalance. And also management of the patient with ascites is very important to know that one of the important management of this patient is, negative sodium balance to reduce fluid retention. We want to reduce the fluid retention by negative sodium balance, and also we reduce any type of food that are, that rich in sodium, such as salty food, salted, any, type of the food that are rich in, in sodium. And also we use to manage to manage the ascites, we use diuretic, and this diuretic with the sodium restriction is very, successful in reducing, ascites. And this is one of the type of the medication like diuretic, spironolactone, as you know, that one of the diuretic that used to treatment for ascites. Paracentesis, what you have to understand that paracentesis is the removal, is the, this is the term used for removal of the fluid, from the peritoneal cavity through the puncture or small surgical incision through the abdominal wall under sterile condition. So removal of the fluid from the abdomen when the patient develop ascites is called paracentesis. And it is, there is some of the nursing management such as, intake. You have to check the intake and output. You take abdominal girth and, daily weight to assess the fluid status. And this is what you have to understand, that patient position when the position of the patient when we do the paracentesis, that patient will be positioned in the chair position and normally in sitting position. And now I will talk about this slide.